What is a root canal? Well, we know a root canal is dealing with what's inside the tooth, and what's inside the tooth is the pulp. And due to physical irritation or trauma, that pulp has become damaged and very irritated. And we need to make sure that we're treating that to prevent any further complications for the patient. When it comes to root canal, there's a series of steps that are going to occur, and it's very important that as a dental assistant you know what those steps consist of and what is occurring in each one. So with the root canal, again, it can be done by a general dentist if he or she chooses to, or it can be done by an endodontist. It typically can be completed in 2 appointments. I know in my office, I worked for a general dentist, and we did our root canals typically in 2 appointments. First appointment consisted of opening up the tooth, cleaning it out, getting our measurements, putting a temporary in. 1 to 2 weeks later, we'd bring the patient back. We'd make sure that the canals were cleaned out, and we'd seal it up or complete it. In an endodontist office, because they have different types of equipment that they can utilize, they can very easily complete a root canal in 1 visit. But it's all going to depend on the condition of the tooth and also the severity of the infection. As with anything in dentistry, there are going to always be exceptions, and there could be some complications that come up that may prolong the completion of the root canal. So again, those are things that we have to be prepared for all of the time. So when a root canal is being completed, we've determined that this tooth is in desperate need of a root canal. Decay has gone into the pulp and is even causing infection, also known as an abscess. So we need to make sure that we're going to gain access to the canals. And the way to do that, if we're working on a posterior tooth, that access is going to be done by using the occlusal surface. On an anterior tooth, that access is going to be done by going in through the lingual surface. The reason for that is because our occlusal surface on posterior teeth are a lot wider than our incisal edge. Our incisal edge is very, very thin, so there's no way that the dentist can make a hole and gain access to that canal. So they have to go in through the lingual surface. So once that opening has been made, the dentist can clearly see each of these canals. And one thing with bifurcated and trifurcated roots is that oftentimes they have accessory canals which will branch off, that the dentist has to make sure that they're very thorough when they're looking into the tooth to try to make that determination that there are no additional canals that might be present that, if not taken care of, can continue to cause issues and problems for the patient. Once the opening is created, we need to clean out any necrotic or dead nerve tissue. If the tooth is still vital, then we need to make sure that all of this tissue is being removed. We're shaping the canals and also cleaning them out. As they're using either the hand files or rotary files, which are attached to a handpiece, they're going to periodically be irrigating it with solution. And the most common type of irrigation solution that's going to be used is something called sodium hypochlorite. And sodium hypochlorite is basically household bleach, which has been diluted with water. So as we're doing endodontic treatment, because we're using different types of chemicals, we want to make sure that, one, the tooth is being isolated and we're providing good moisture control. And the second one is to prevent any of these chemicals from going into the patient's mouth. So we talked about different methods of moisture control in DEA 102, and the one we're going to be using in endodontics is going to be what we call the rubber dam or the dental dam, and that helps to, one, isolate the tooth, provide good moisture control, and also prevent things from going into the patient's mouth. So we're going to be squirting some of that solution, some of that sodium hypochlorite into these, and why that's being used is because it helps to cleanse, it helps to dissolve any debris that might be left in here. It helps to deodorize. It also is an antimicrobial agent, so it helps to clean out the canals very, very nicely. Once it's been cleaned out, it needs to be sealed. We can't just leave it open because we want to make sure that the apex or the apical foramen is going to be sealed off. And if you remember, the apical foramen is the opening at the tip of the root, which allows for the blood and nerve supply to enter into the tooth. Well, we want to make sure that this is sealed off, because if not, what's going to happen is bacteria is going to come into this canal and allow for reinfection of the tooth. So we're going to use a material called gutta percha, and gutta percha is a very rigid, rubbery type of material. It gets heated up in something called an obturator, and they place it into this machine, and they heat it up, they remove it, and it becomes very flexible and very pliable, which allows it to basically contour to how that canal is shaped. There are some roots that are very curved at the end, so because it's been heated up, it allows it to flow very nicely into whatever shape that canal is going to be. Plus, we've created a larger opening of the canals, which oftentimes we may have to put a couple of different types of, or a couple of different pieces of gutta percha in here to provide a very good seal of each of these canals. So once a canal is placed, or once the gutta percha is placed, we then send the patient back, if they're in an endodontist office, back to their general dentist to get the permanent restoration put on. Because the patient has had a root canal, we oftentimes will treatment plan a crown, permanent restoration, because when we remove this blood and nerve supply, the tooth becomes a little bit more brittle, and we want to make sure that we're protecting the tooth. And the best way to do that would be by putting a permanent restoration like a crown on top of it. Because this tooth has been endodontically treated, we want to make sure that we're providing a little bit more retention and stability to it. So a post is going to be placed, build-up done, the tooth is going to be prepped, and then the crown, which is going to be the last step, is going to be cemented onto the tooth to protect it and protect the patient's investment. So very important to know why we're doing what we're doing in each of these steps. Again, patient has spent a lot of money to get the root canal done to save their tooth, which in the long run is going to be a much better decision because it's going to help to preserve the alveolar bone that's there, as long as there's no periodontal disease that's present on this tooth, which obviously will be checked prior to doing the root canal. But in the long run, it's going to be a much better option for the patient.